Carpal tunnel syndrome, very common. Basically, it's pain in the wrist that radiates into the part of the hand. Sometimes the entire, sometimes a portion of it. But basically, it's a pain in the wrist with movement, and usually that's associated with people who work a lot on the computer or with their hands and dental hygienists, um, mechanics, any type of profession, construction workers, where they put a lot of stress on their wrist. So then there's something called carpal tunnel syndrome. Now, what is that exactly? There's a tunnel in the wrist, okay, and underneath that, inside the tunnel, there's a nerve called the median nerve. It runs inside. So what happens with excessive work or too much stress and weakness in the wrist and the muscles of the arm and shoulder, then these bones shift around, and sometimes when they shift around, they will decrease the space that's part of the canal, and will actually physically compress on the nerve. And as chiropractors, we adjust the wrist. There's a common muscle called the lunate, or a bone, one of the carpal bones of the wrist, that sometimes zips and decreases the space. And there's a specific adjustment for that we push it out in case it's caused from that. Okay. Now, there's some exercise that you could do, in case you don't have access to a chiropractor or can't afford it or you're far from it. I will talk about that. But another cause is, if let's say it's a chronic issues with the wrist for, let's say, years, and it's inflamed, what happens sometimes, the ligaments will thicken in that area and scar tissue will start forming because of the inflammation. So then that's where a lot of time they end up having surgery, and they go in there, try to clean it up, increase the space where the median nerve exits. So it's a common surgery they do. But I don't recommend that you jump into surgery right away. Give it a chance of doing, exercises, specific therapies that are very helpful. Over the last 34 years being a chiropractor, I helped a lot of people avoid surgery and get relief from carpal tunnel. Okay, so basically, what we're gonna do, I want to make it brief and talk briefly how to manage it. First of all, we would need to put ice on it, control the inflammation. Never apply heat for carpal tunnel, okay? Because there's inflammation. The inflammation is causing the body to lay down fibrous tissue. This fibrous tissue is sticky material in there. It becomes like glue, and they cement, and they sometimes attach on the nerve, on the bones, and decrease the canal, okay? And make the problem complicated. So we want to stop the inflammation, okay? And so ice, you would do it for like 15 minutes, and you do maybe 3 to 5 times a day, or even more, an hour in between, or 45 minutes, and you can do it for 15 minutes. That works really good, okay? That will give you some relief. Now, another muscles that I want you to keep in mind when you're dealing with, if you want to get some relief, is the extensors. These muscles of the forearm, okay? They usually are very stiff, okay? Especially from the work that we do, they stiffen up and they pull here, and sometimes they are really the cause of why there's a lot of stress. So I want you to massage these muscles, okay? Now, if you have a portable TENS unit, some people have those at home, like a portable, like with the electrodes that you can put them on, and battery operated. That would be helpful. You can put them right on the forearm, and you can put on the wrist from the front and back, and do like maybe half-hour sessions with that, with the ice and or without the ice. That is helpful. But if you don't have that, that's fine. Okay. What you could do is focus on massaging here. Okay, these muscles. Okay, and then I want you to remember that a lot of times the carpal tunnel started because of tension in the neck, upper back area, shoulder, because these muscles, they also play part in the movement. When you move your arms and wrist and elbow, the shoulder girdle has to move, the scapula has to swing. So if these muscles are not moving, okay, and not flexible and not cooperating with it, we end up overstraining. I mentioned before about how tennis elbow and golfer's elbow can occur, but it's the same thing. Carpal tunnel can occur from that, especially with repetitive, it will focus here rather than here, okay? So part of treating the carpal tunnel, you want to do exercises besides the icing, and of course you can use compression like elastic, bandage, or there's special orthopedic, wrist support that will hold it. That way it avoids back and forth, so it doesn't keep getting irritated. That is helpful. but ultimately you have to do some therapy, some exercises to strengthen it. Okay, so then part of those exercises, I did a video you'll find among my videos that that shows you how to exercise, um, how to stretch and strengthen the core of the upper back, lower neck area, okay, shoulder, using doing some stretches and using simple dumbbells. Now that will stretch and relax and strengthen these muscles, which also are contributing to the carpal tunnel. Okay, so remember, you don't want to be just focusing just exercises here and doing different things, because I've seen sometimes patients telling me that they've been doing these special exercises. I mean, there's these exercises, like this is actually a good exercise. We call it like the infinity sign back and forth, or you can call it the composer. You can go in the figure eight, basically back and forth. These are good exercises to mobilize and to break up scar tissue. Okay, and then you can do also, you could use this other arm to stretch gently forward, and you can stretch forward. Okay, so this is a good way to stretch and break scar tissue. But remember, now if you have acute pain, a lot of pain, you don't want to be doing that. You want to first ice it, let it calm down, settle down. It feels better. Now we begin to do some exercise and stretches. Okay, then we can do this. Okay, we can start with the figure eight, right? And you could do that, and you can play music in the background and have fun doing this. Okay, and then you could push, and like, look what I'm doing with this arm. I'm pushing, I'm extending. Okay, and I'm holding it. I just take it to as far as it goes, and I hold it for 10 seconds, and I take out the slack. Gentle, very gentle. Don't do it too fast. Like maybe every 10 seconds, push it, and then you could do the same thing down. Okay, same thing this arm. Okay, you do, depending on which arm is involved, right? So these are good exercises. And then of course we talked about shoulder shrugs, doing stretching and strengthening the trapezius, upper back. And again, in that video, you will see all of them, but I wanted to include this movement. And then one last thing before we end this video, if you want to diagnose it to see, do I have carpal tunnel or not, it's a simple test that you could do. It's called the prayer test. You put your palms together like this and put it in front of you and bring it down like this. Okay? Now, if you feel pain in your wrist, that's usually indicative of that you have carpal tunnel. Another way you could do it is you can bring your wrist together like this and bring it straight up like this. Okay? And up and basically, and you hold it for like 10 seconds or so. If you start having pain in your wrist, that means there's pressure on the nerves, and that is another indication that it could be carpal tunnel as the problem. I hope this video is helpful. I just want to educate you a little bit about carpal tunnel. I know there's a lot of information, there's a lot of different approaches to it, but definitely a good chiropractor experience is good at treating those in case you try these exercises and the things that I shared with you. If it doesn't work, then I recommend maybe seek one in your town to help you to do more therapies, and maybe it needs to be adjusted. If the bones get shifted, sometimes they have to be adjusted, and the chiropractor is the most qualified when it comes to that. Of course, they'll do x-rays to make sure that they could adjust it and make sure there's no arthritis or any fractures or anything like that before they do that. Of course, that's an area of their specialty. They know all the workups that they need to do. But these exercises are very helpful, and I want you to remember that how it is all tied up together, how the health of your neck, shoulder, upper back has an impact on your carpal tunnel, just like I talked before about tennis elbow and golfer's elbow. If you have any questions, leave comments. I don't know if I mentioned it, and comments below, and I will do a video or will answer your question.